All right, so hello to those of you who are tuning in today. My name is Brianna Contreras, and I'm an associate editor of Managed Healthcare Executive. Today, I have Krista Drobac here with me to discuss the impact of telemedicine's recent rise and the response to the COVID-19 pandemic. Krista is the executive director of Alliance for Connected Care, and she's a partner with Sirona Strategies in Washington, D.C. Thanks for being here with us today, Krista. I'm happy you could join us. Yeah. So to start off the interview, I'm going to just start off by saying we are now more than a month in past President Trump's declaration of national emergency and the expanded use of telehealth under CMS's emergency rules. So what has been the feedback you or any peers that you've noticed just going on right now?
An incredible rise in telemedicine visits. People are absolutely utilizing telemedicine platforms across all of our members, health systems and vendors, and technology companies. We're seeing enormous numbers. For example, American Well is doing 30,000 telemedicine visits per day. One of the hospitals in our group was doing 2 or 3 telemedicine visits per week in January, and now they're up to 10,000 a day. So, imagine the onboarding of physicians and teaching them how to do telemedicine visits all while this is happening. It's like flying the plane while building it. So
Right.
There's been already a couple of patient satisfaction surveys out that show high satisfaction. So we're excited about that. But I would just say it sort of exploded onto the scene, essentially.
Okay, wow. So kind of to piggyback off of that, so has the Alliance or any other entity gathered survey data on the effect of telemedicine at the practice level, especially among those who have not used it in the past?
Not yet. What we do know so far is independent physician practices in particular are really hurting because there aren't a lot of elective visits happening. And they are doing telemedicine visits, but it's not quite making up the volume that they previously had. So, I think going forward, there's going to be an interesting discussion of how telemedicine and virtual care mix with in-person care, and how do you, go back to a robust practice with, your patients getting all their needs met, and how do you sort of split that up between what's virtual and what's in person. But it is certainly on our roadmap of things to do. It was just the first month has just been trying to figure out the regulations and what it all means and getting it all situated.
Right. Okay. Now, how is the Medicare billing process going? Have there been any surprises?
It's actually going pretty well. They have essentially waived everything, and there aren't really any guardrails around what can be reimbursed in Medicare. Most of the vendors that we have in our coalition, like American Well, MD Live, Care Innovations, they already have relationships with Medicare enrolled providers, so they could serve patients through those avenues and didn't necessarily have to get enrolled in Medicare themselves. Obviously, our health systems already are Medicare enrolled providers, so they could just start seeing Medicare patients right away. It was there was some question about the vendors that have physicians who are on staff, and how does that work, because they don't have practices and they're not enrolled in Medicare. But honestly, there's been enough business, not necessarily business, but like consumers who need telemedicine visits coming through their existing relationships with hospital systems.
Okay. Now, what about commercial payers? What are the successes and missed opportunities here?
So commercial payers are waiving telemedicine visit copays, which is really big. Because not only do they see the value in it, they're covering it, but they're also saying it can be free. So I think that's been a really big breakthrough. We had a breakthrough legislatively on the commercial side. There are 32 million people in this country with health savings accounts, and those are very, very strict rules through the IRS. And in the third supplemental package, Congress allowed for free or discounted telemedicine visits for people with HSAs. So that was a big deal, because it means essentially health plans and employers can offer free or discounted services to people with HSAs. And most of those people are in the large group market and the commercial market.
Awesome. Well, it's obviously helping a lot of people then, which is good.
Yeah.
And then are there any other conversations you're having in Medicare?
Well, there's been a lot of conversation about technology. So what modality is appropriate? We've had, obviously video is fine and audio video is fine. That means essentially you can use a smartphone that has to be video enabled at any point during the call. And there were providers saying that they were missing patients because some patients don't have video capability, especially if you live in an underserved area and don't have broadband. So there are a couple of codes that are audio only. Those are E&M treatment codes are audio only. But so far CMS has not made blanket, audio only admission. So that's one discussion in Medicare. Another one is, they waived temporarily the HIPAA compliance on the platform. So right now you can use Skype and FaceTime, for example. What does it look like going forward? I think most probably agree that HIPAA compliance is important. So was a temporary issue. And then the other issue in Medicare really is, what are the program integrity guardrails for the future? The guardrails that were put in the original bill were not workable, and so Congress just deleted them. So instead of amending them, we essentially don't have any guardrails right now, and that's not necessarily good for the industry or stakeholders because, we want the good actors to do well, and we don't want the, doc in the boxes to just start dialing up Medicare beneficiaries. So that is one area that we still need to really work on.
Okay. Now, which area of practice has telehealth made the biggest impact? For example, areas of primary care, oncology, etc.
I would say right at the very beginning, it was really triage, big time triage at the hospital system. When do you need to get a test? Those kinds of things are obviously still happening, but that was kind of the first wave of really important functionality to get up and running. I would say the second wave was primary care. Now we're getting really into behavioral health. People have been locked in their houses for a month, and how do we treat people with mental illness or even just now mild depression? The DEA did waive some prescribing regulations so that you can prescribe controlled substances over telemedicine, which is good for people with serious mental illness, because a lot of those drugs are controlled substances. And then of course now we're getting into specialty, but the challenge with specialty is that as long as there are still no elective surgeries, the only really things that you can do on specialty is triage again. How is this an emergency? And then of course, you can figure out a course of treatment, but most likely the treatment in the specialty areas is going to be, in person. So there's some limitations on specialty at this point.
Okay. Now, what are the long-term benefits in specialties? Or excuse me, let me rephrase that. What long-term benefits and specialties are making the best use of telehealth?
Just in specialty? Or
Yeah, just in specialty.
Yeah, because primary care and behavioral health are really the first, big time use cases. And then of course, specialty, dermatology has always been on the leading edge, radiology. I think that specialists are honestly just figuring it out now. I'm not sure beyond the more traditional specialties like dermatology that have been using telemedicine extensively already. I don't really know that, there's going to be, I don't know what the breakouts are going to be, honestly. Obviously, neurology has been using telemedicine for a long time on stroke, but that's mostly been inpatient. Dialysis patients are now getting visits from their nephrologist through telemedicine. But it's sort of hard to tell, which specialties are going to start to really become, big users of telemedicine.
Okay. Now, do you have any interesting anecdotes about telehealth use that are illuminating on its potential?
Um, Boy, I haven't dwelled in anecdotes other than what my parents tell me. I think for us, for the advocates, the biggest problem has always been that first visit. People just believe that in person is better care. And until they really have a visit, they don't really see that you can actually get a lot through a video. You can take your full history. The doctor can guide you through, some simple ways for them to see you through the video. So I think that first visit hurdle is going to be gone when this is over. So we will have, millions of new patients that have experienced telemedicine for the first time. And given the patient satisfaction surveys, they like it. So, my experience with my parents and others who I encourage to use telemedicine is the same. They're like, wow, this is really cool. And I didn't even have to go anywhere. I didn't have to sit in a waiting room with a bunch of sick people. So I think that it's going to be fairly widespread, that people are going to be surprised at how you can get good care. And that's going to be great for, changing the laws permanently.
Oh, definitely. And although it's just a very unfortunate time, this really, is good for telemedicine because it's giving people that first time experience, just like you said. So
Yeah.
definitely a good thing in a way.
Yeah.
Now, next, we are hearing that telemedicine's expansion from COVID-19 will lead to lasting change. Do you expect to see some of the temporary rule changes to be included in the next physician fee schedule?
Well, CMS does not have the power to make them permanent. It has to be Congress. CMS is acting on the power that was given to them in the first supplemental, and it only lasts until the end of the public health emergency. So it's really up to us as telemedicine advocates to gather the data that is necessary to show policymakers that it would be good to have as a permanent part of the Medicare program, that we have to show cost, we have to show data on cost, quality, patient satisfaction, the kinds of access that people have, like are there areas of the country that still really need broadband investment? Those kinds of things are going to be critical for us to show Congress that this should be made permanent.
Okay. Now, under the proposed guidance from the White House for reopening the economy, is there a role for telehealth in elective surgeries, such as greater use of consults or more?
Well, our thought is that one of the ways that we could think about elective surgeries is that we could get the patient out of the hospital faster. So, even just between having my two children, the first, child, I was in the hospital for 2 days, and the second child, I was out of there in 24 hours. Why couldn't we think about more care in the home and more virtual care as a way to get elective surgeries, moving again? So I do think there's a big role in telemedicine for post-operative care. And so I hope, and remote monitoring too, honestly. I mean, you can do so much now measuring a patient's biometric data and their vitals remotely. So I would think that a combination of those things could really get things moving again.
Okay. And lastly, what's next for telemedicine?
Well, I think the biggest name of the game right now is adoption. If we can get people to adopt it, then we get policymakers who want to invest in it, and we get physician offices who also want to invest in it and make it part of their workflow. So, this is really a bottom-up game. It's not going to, Medicare is not going to change permanently unless we've got grassroots on the bottom who are saying, this is something that we want to keep, and this is a benefit that we want to keep. So we can't have that without widespread adoption, and that seems to be happening.
Okay. Well, that concludes everything I have for you. Was there anything else you'd like to add, focusing on telemedicine, or just anything else going on right now?
well for any of your, readers who are, or watchers who are in touch with any of their members of Congress, encourage members of Congress to make this permanent.
Okay, great. Well, thank you so much, Krista. I appreciate your
Yeah,
time.
thank you.
Hopefully, you're
Thank you.
staying safe, and
You too.
I hope to see some positive changes out of this. I'm sure you do as well. And hopefully, this all ends soon.
I agree. I agree.
All
Take
right.
care of yourself.
Thank you so much. Bye.
Bye-bye.
Thank you, Brianna. And don't forget to check out the websites of these MJH Life Sciences brands and more to get additional information across the medical field.